Today I want to talk about some pearls of using pre-chop for nuclear disassembly. In my mind, as with any nuclear disassembly technique, it starts with a good and thorough hydrodissection, which is going to make any rotation maneuvers much easier and much friendlier to the zonules. I then use some cohesive viscoelastic to clear my view and deepen the chamber, and then introduce this Akahashi pre-chopper through my 2.2 millimeter clear corneal incision. I use the sharp side of these spatulated blades to enter the lens nucleus just short of the middle of the nucleus, and then I slowly spread, which you can see divides this lens nicely into two halves. Then I rotate these blades and just gently engage the lens nucleus. If I use too much force here, too much downward force, it's actually going to increase the friction with the posterior capsule, which will make it harder to rotate. So basically I just use a light amount of force and then trace my capsule rhexis. Then I use these blades to divide the proximal half and then the distal half, the result being that I have 4 quadrants without having used any aspiration, any irrigation, or any phaco energy. And the next step is getting them out. And similar to those of you who use phaco chop, sometimes these pieces can want to interdigitate or jigsaw, and so getting them out of the bag can be a little bit of a challenge. And one thing that I've found useful is to debulk centrally here to create space to be able to deliver these quadrants. So you can see that I'm doing that with my phacoemulsification handpiece here. And then I take my second instrument and basically use it to hold back the adjacent quadrant as I take one corner of this quadrant and deliver it into that space I've just created. And once I'm able to get that started, typically it comes out without difficulty. Then I'm able to let it tumble into my handpiece there. And typically, the remaining quadrants are less difficult to deliver. So here's another example, again going through my 2.2 clear corneal incision, using those sharp ends of the blade to engage the nucleus just shy of the midpoint and slowly spread, dividing this into two halves. Then I rotate my blades to the side, just gently engage with those tips without undue downward force, and trace the outline of my capsular rhexis, being very patient, allowing it to come around. And then I begin to divide the proximal and then the distal half. You'll see here in a moment as I go to divide the distal half, the patient moves their eyes slightly, but we're able to complete this division without difficulty. And again, we use our phacoemulsification handpiece to debulk centrally to create room in order to bring up primarily the first quadrant. I'll use my second instrument here to hold the adjacent quadrant out of the way. And then I grab one corner of that quadrant, and in order to bring it into the anterior chamber or into the iris plane, I have to bring it first in and then up to sneak it around the edge of my capsular rhexis. And then it tumbles quite nicely, and the remaining pieces are less difficult to deliver. And here I'm going to show you a couple of special situations. So this is probably a 2+ NS cataract. You can see that I engage it here in similar fashion to the other cases, and then it splits nicely into two pieces. You'll find that the pre-chopper is probably best for 2 to 3+ NS. Anything less than that has a hard time splitting, and denser than that, even the sharp end of the blades typically won't engage without undue stress on the zonules. And so here you can see I'm trying to rotate it, but it's not rotating as freely as I'd like. I'm seeing more movement of the nucleus than I'd like, and so I ask for my second instrument here, and I'm going to try a bimanual rotation. And so I introduce that into this crack, and at first I'm trying both instruments on the same half, and it doesn't work as well as I'd like. It's just not rotating very well. But then you'll see I take my right hand and begin using the two instruments, crossing my hands on different halves, and it rotates much more freely. Essentially, I'm attempting to rotate the nucleus on its central axis without stressing any of the zonules. And once I get into position, I'm able to again divide the proximal half and then the distal half. And the rest of the case goes without difficulty. This patient did not require any capsular support devices. Now you'll see here after the first spreading, I need to go back out, and you can go out more peripherally, but one has to be sure to drop your hand to keep from going close to the posterior capsule. And this is a case where I feel that the pre-chop really shines. This is a patient, you can see they have Malyugin ring. This is a Flomax case with poor dilation. We've already noted that the patient has poor iris tone. And in these cases, the irrigation and aspiration or flow is just as much your enemy as the phaco hand piece is in terms of iris prolapse. And so being able to divide this nucleus into 4 quadrants without introducing irrigation into the eye and without using phacoemulsification energy, I think is a real benefit. And you can see that this instrument is nimble enough and dexterous enough that we can use it even in a small pupil case, even with a Malyugin ring in the anterior chamber to divide this lens into 4 quadrants. See, I'm going to divide the second half, and then partly because my view is obscured, I'm not entirely sure that this crack is completed all the way to the posterior aspect of the lens. And so what you'll see that I do here is I take my pre-chopper and I rotate it so that the curved end is down so that I can go deeper safely, and then spread again to be sure that these 4 quadrants are entirely separated. Thanks for listening, and good luck.